Hi there. My name is Ian Matthews, and I'm an ER physician with the National University Health System, Singapore. So I've been using BotMD at work. Recently, I had a 65-year-old coming in with a proximal DVT, and I wanted to start Clexane, but I forgot the dose. So I key in the dose of Clexane in DVT, and it prompts me whether I want it for treatment or prophylaxis, and I chose treatment, and it gives me the dose. Now, what if I want to dose adjust it for somebody with renal impairment? So I key in dose adjust and it gives me the various options of dose adjustments. Now I scroll down to the renal impairment section and I can get a dose adjustment for renal impairment. Now, in terms of scores, I recently had a patient with a traumatic pneumothorax, and I was showing a bunch of residents the x-ray, and I wanted to quiz them on the size of the pneumothorax, but obviously I had forgotten. So I then key in a pneumothorax calculator and it shows me how to calculate the size. Then I wanted to put in a chest tube, but knowing that my hospital protocol has certain requirements, I key in chest tube protocol and it reminds me of the things I need to do for my pneumothorax. Now, as an example of on-call rostering, for a motor vehicle trauma patient, I wanted to know who the surgical senior resident on call was, and I got Dr. Sim's number. If I just click on that number, it would direct me to call him. Prior to using BotMD, I was using Google and hospital intranet on desktops for most of my information query searches. The biggest value of BotMD for me as an ER physician is the speed of search to get the information I need, which allows me much more time to focus on my patient.